Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome back. My next guest is Kristy Carter, who is a psychiatric nurse practitioner out at Family Practice Associates. Welcome.
Thank you.
Now, I talked about we got less light, are you depressed? And I used the term seasonal affective disorder or SAD. Tell me what that means.
So seasonal affective disorder is a type of depression that tends to correlate with the seasons. And for most people, get depressed when the light goes down. So when there's less daylight outside and there's more dark hours in the daytime, they don't get enough sunlight and they start feeling more depressed during those months.
Now when you say feeling depressed, kind of describe, how do you know you're depressed?
Well, probably the biggest difference between feeling blue and then feeling depressed is like the duration and the severity. So for depression, the duration has to be 2 weeks or longer, and then it can affect other things in your life, like your appetite, your sleep, your social functioning, maybe your work, maybe you can't get up out of bed, you're having trouble getting to work on time, that kind of thing.
So what do you do?
Well, there can be a lot of things. Therapy can help. There are non-medication treatment options like exercise, diet, light therapy boxes, and then there's medication treatment options for that as well.
Okay. How do you know when you need to actually seek treatment?
Well, I think that if you're experiencing depression for a couple of weeks and you're having some functioning issues, if you're having trouble with your appetite, not sleeping well, having trouble like functioning in your day-to-day life, socializing, going to work, that kind of stuff, then you probably need to seek some professional help for that. And
there's nothing wrong with doing that, with seeking therapy? Absolutely
not. No, I don't think so. A lot of people do it, and I think the stigma is going away for that. One in 5 people will experience depression at least once in their lifetime.
So if you've tried the exercise and you've tried the light box and you've tried the therapy and it's not working, there are medications.
Yes, sir.
Tell me a little bit about the...
So there's different types of medications. Wellbutrin is actually known to treat seasonal affective disorder, but it's not for everybody because there's certain contraindications with some people for that. SSRIs are typically first line for a lot of depression and anxiety issues. That would be things like Prozac, Lexapro,
Zoloft. You use the term SSRIs. It's a serotonin.
Serotonin, yeah. It's a serotonin-based medication, serotonin reuptake inhibitor. And then we also have newer medications on the market that target other chemical systems in the brain. So we now use atypical antipsychotics for treatment-resistant depression. So if you have an antidepressant on board that's not working well for you, we can augment that with an antipsychotic, which sounds scary, but it's really working on the dopamine system in the brain, and they work very fast. And there's some newer treatment options as well. So there's a new medication now on the market as well that actually works on glutamate centers in the brain.
Okay, so we've got less light, we've got stress of the holidays. What happens after the holidays and you got a little bit of holiday letdown?
Well, that's usually when a lot of people start feeling the seasonal affective disorder. I think people have a lot to look forward to in the fall. They got the fall festivals and Christmas and Thanksgiving and all that stuff. And then when all of that stuff's over, there's not a whole lot to do. There's not a lot of activities scheduled between New Year's and spring. Yeah. So then a lot of people have that let down, and it's like there's nothing, they don't engage in a lot of activities, they're not getting out of their house as much because it's cold and dark outside, and then they get more depressed.
So if you have depression, you take care of it yourself, that's great. But sometimes family members need to encourage people to seek treatment.
Oh, absolutely. Sometimes people get so depressed they don't want to hardly get out of bed, let alone make a phone call to try to get an appointment with a provider or to get some help.
So encouragement by family is helpful.
Very helpful, yes.
We thank you for all the work you do. We thank you for coming in, and thank you for all the care you give the patients.
Thank you very much. I appreciate it. Thanks for having me.
We'll be right back.